Health Tech listeners, I'm your host this week, Hayley Levine. This is the podcast where we tackle some of the trending topics, ideas and best practice in health and social care. This week we have a very special guest. We're joined by Terry Murphy. Terry has been in the NHS since I was born, I've heard.
Yep.
Literally the year I was born, he started in the NHS. I'm quite young, obviously. You're not old, Terry.
You're very young, Hayley.
And yes, so he is the National Business Development Manager at Radar Healthcare. Terry, outside of work, likes a lot. He likes the finer things in life. Terry likes red wine. He likes France. He has a villa in. Is it a villa in France?
Yeah, I do. Yeah.
He's a climbing instructor as well.
Yeah.
Likes walking, cycling, pretty much everything you can imagine Terry will like to do. Likes cooking as well, I've heard.
Yeah, I do. Yeah. It sounded like a Miss World interview.
Yeah, it does.
He likes world peace.
It does, but no, I think the audience should know exactly what you're like, Terry.
Thank you.
But yeah, we've worked together for quite a while, so we worked together at a previous job and now here. So has it been around 6-ish years now?
No, I've been. Oh, what, worked together in total? Yeah,
Yeah.
probably 6 to 8 years. I would have thought. Yeah.
Yeah, it's flown by, to be honest.
Yeah, it's
Really
been a breeze.
has. Yeah. Oh, it has. No, it has. So yeah, I just want to find out a little bit more about you, about kind of what you're trying to achieve in the NHS, a little about some new news, which I'll talk about a little bit later. But first, what brought you into healthcare?
I kind of got into it quite by accident, actually, because I was working in the private sector for BT, and I had a young family at the time. So Hope and Ethan were 4 and 3, and do you know what? When I had the kids, I thought, actually, I'd love to be a stay-at-home dad and do all of that. It's not something I never had, and I thought, I want to do this. But I was working for BT. My journey time up to work, I left at 6 in the morning before they were up, and then got home 8 in the evening after they'd gone to bed. Yeah. And I didn't like that at all. I kind of wanted to be a part of their life. I'd ring them when I was at work. So one morning, I got up, got on the train, went to work, changed platforms, went back home again.
Really?
Yeah. And Jade, my wife, said, "What are you doing home?" I said, "Can't do that anymore. I want to be with the kids." Oh. So I rang a very good friend of mine who was a GP in London and said to him, "I've just quit my job." And he said, "Why have you done that, you idiot?" And I said to him, "Well, you know me, I want to be with the kids." And he said, "Well, come and work for me." So he was a GP in Tower Hamlets, and they had a practice that were just moving away from paper to computers. Never used computers before. And he said, "You know about tech, don't you?" And I said, "Well, yeah, of course I do. I could switch a computer on." So that was my first foray into the NHS, really. So I worked with them for 7 years. And I went in on a temporary basis because I just wanted to find out what I wanted to do. But the main thing was take the kids to school every day, pick them up. And I managed to achieve that working in the NHS. So that's where it all started.
Yeah. It's such a contrast though, isn't it? Like you say, I was able to work less hours, and now obviously GPs, people on the front line, are having to work more hours. Yeah. And they are struggling to see their like kids and families and things. So do you think, like, going back to the NHS now, would you have done the same thing?
Yeah, definitely.
Yeah.
Definitely. I think, look, when you have a purpose in life, when people are serving you, which everyone that works in the NHS does, from the receptionist to the surgeons, if we could phrase it like that. Yeah. And I was acutely aware that's what I wanted to be part of.
That's really nice. We've done quite a few podcasts now, and every single person that works in the sector talks about passion, and despite the fear of going into it, they're just so passionate, and people don't go into it because it's a job. People go into it because they really, really care. Why do you think that is?
I don't think anybody in healthcare sees it as just a job. It's a vocation, it's a calling. They certainly don't go into it for the money. because I was on the train up here. I was looking at what a band 1 nurse gets, for example, and they start on 18k. A band 5 goes up to 25k, and if you've got a family as well, you're working all the hours, so a 24-hour shift pattern.
Yeah.
You don't go in for the money. It's definitely a vocation, and do you know what? I salute that, and if I can be part of what they do by providing services like we do, then I'm in it for the long haul. And 30 years is 30. I had hair when I started.
What happened?
The NHS. I have no hair now. Yeah. So look forward to that, Hayley.
Oh no! What's going to happen? I can't lose my hair.
Yeah.
So talking about kind of how we help. Talk to me about your role and how you work with the NHS.
Yeah. So ostensibly, I think Radar Healthcare, we're disruptors in the market. Okay, so we bring something new and exciting, and it looks good as well. It's got lovely colours, but I guess when I'm talking to our existing partners and potential partners, what I want to be able to do is really get to the bones of the things that cause them pain on a daily basis. So the structures they have in place at the moment, do they really work for a modern NHS? And the answer that I'm getting back time and time again is what we have at the moment doesn't work.
Yeah.
And let's take it back a step. I'm not concerned really of the product that we offer. Okay, I'm concerned about the hole that it fills. So a lot of my conversations, I very rarely talk about the product because I want to understand what is it that you do. And that's where I think my gift is in the questions and getting to understand really the issues that you're facing. And then we can talk about how we might fill or expand on what they do.
And have you had any specific feedback from partners that we work with around your approach? And
yeah, I think one that sticks to mind is, and somebody actually posted this and said, do you know what, Terry was really helpful. He really understood where we were coming from, what we were actually trying to achieve. And we couldn't achieve everything for them, but the key areas that they were looking to, kind of plug that gap, we were able to do that. And I think, most of the time we find that people talk and talk and talk and very rarely listen to what's going on. And I think across our organisation, that's what we're good at. So from the frontline sales element, if you like, and I don't really like the word sales element. It's more of a consultancy element to the people that deliver, to the marketing team. We listen, and that's what we're good at. That's why I'm bought into what we do.
Yeah, what I love about our company is we all talk about all the time, partnership. Yeah. Everything's a partnership, but you think about sales teams, business development teams, and people think, sales, I don't want to be bothered, but our approach is so different. We do consult, we do have a conversation to understand them right from that first contact with you guys, right through their journey with Radar Healthcare. Why do you think that's quite rare for a business?
I think if we think about Radar, firstly, okay, we're a company that's 12 years old, 10 years old. Can't remember. It's 10. It's 10 or 12. When we have leadership like Paul and Lee, that kind of filters down, and it's more about. There's nothing wrong with sales to start with, because we all sell and we all buy stuff.
Yeah.
But I guess to answer your question, it's kind of drip fed down from leadership, and it's kind of our ethos as a company. We're there to help, we're there to sell a product as well, but the core of it is about what we're going to do for the end user.
Well, yeah.
I think.
Yeah, no, I agree. It's one of our values, isn't it?
Yeah.
Customer focused and partnership, and it makes it an easy job for me to market.
Yeah, brilliant.
So just talk to me a little bit about kind of what you want to achieve at Radar Healthcare and in the future, I guess. Just what do you want to do in your life?
In my life? Well, who knows how long I've got left. But I think with Radar at the moment, it's fulfilling my ambitions as to where I am. So, I don't just go and talk to customers and potential customers. I work with our team as well. So, recently we've done some coaching sessions with our team in London, and I've been part of that, putting that together. And I think that kind of helps me as well as an individual, because it feeds into another one of my passions in seeing people develop in their careers. And, they might be working at Radar today but have aspirations to move on. And that's one of the other core values of our organisation.
Yeah, definitely.
So,
yeah. Speaking of that, so you let us know some really good news recently, that you are going to be coaching and helping and volunteering with the NHS.
Yeah, so
talk to me about that.
It's quite an arduous process to go through, and it's something that I've been thinking about for quite some time. And it's all about kind of my ethos of giving something back to those that serve us. So I approached them and said, I'd quite like to be a coach within the NHS. I can give you X amount of hours a week. And then I had all these documents to fill in, and you're kind of going back over your qualifications. And I found out just yesterday that I'd been accepted as a leadership coach. What does that mean? Who knows? But if you work in the NHS, what you're able to do is say, I need some coaching because I've got this aspiration, or I've got an issue with what I'm doing at the moment. And I will just be there as an ear for somebody, really, that comes forward and says, I'd kind of like to go into this. So I'm part of a big network. There's a Pan-London network, and I'll have up to 10 clients, perhaps, in the coming months. And they've got this continued development as well, so I continually develop through the NHS. But yeah, that was great news for me personally, and it kind of talks about us as an organisation.
Yeah.
I mean, I don't want it to sound a bit like a love fest for Radar, because but these are true. This is true. These are facts. We're doing stuff.
Yeah.
And we should speak about it.
Yeah, definitely. Do you feel proud to be doing what you're doing?
Yeah, and with the backing of the organisation as well. Yeah, of course. Yeah, immensely proud to be accepted on doing that, and sharing my thoughts, listening to people's aspirations.
Yeah.
Yeah.
And what does it mean to you to work in healthcare?
I guess, look, the main thing is that, so my daughter's in the services as well, so she serves London 24 hours a day. And I see what frontline clinicians are up against. I've seen it firsthand, and I've seen the hours that doctors work. And in my own experience, I've seen that, and that's what drives me to keep giving. It's serving, Hayley. That's the key thing. It's serving. It's not about the reward in terms of what I get out of it, but the serving those that are in that profession is key. And at the end of that is you and I, the patients.
Yeah.
And that's why we do what we do.
Yeah, so get a bit personal now. Obviously, you've had your own health scare recently. Yep. Are you okay to talk about that?
Yeah. What would you like to know?
Well, what happened? Obviously, I know our audience doesn't really know. I understand it was in France. So obviously, you were in a French hospital, which must have been really scary. And just talk to me about kind of your experience.
Yeah, so we were travelling back home from France, back to work. And that might have been the stress that caused it, actually.
Maybe.
Yeah. I'm going to we'll dig deeper into that. Because I'm a therapist also. So we were driving back. Jade, my wife, said to me, how's the chest pain going? Because I thought I'd pulled something. And then she said to me, you're not having a heart attack, are you? And I went, no, I'm far too young for a heart attack. I've just pulled a muscle or something. And then apparently I I wasn't very chatty, and she'd taken a turn off in France to the hospital. We've both got a kind of understanding of the language. We can order food, beer and directions. What else do you need? So then I was rushed into hospital. I was in the middle of having a heart attack. The surgeon said to me, 10 minutes later, Monsieur Murphy, and it will have all been over. And then I took a ride in a helicopter to have some emergency treatment, and said goodbye to the kids. I was adamant that I need to speak to the children before then. But I thought, Hayley, life was over. Jade said to me, do you remember handing me your phone? And I said, no. And she said, unlock my phone. I've got a couple of meetings on Monday. Can you ring the office?
Oh my God.
And there's that famous saying, isn't there? Nobody on their deathbed says, I wish I'd spent more time at the office.
Yeah.
But so, yeah. And I said, do you know what? I don't remember you saying that, but she'd contacted the office on the Monday, or a text, and said Terry's, in hospital. But, hey, listen, I live to smile another day. And I think I kind of took my health for granted, really.
Yeah.
I was a bit lazy. Didn't exercise as much as I used to. Loved my food. Working my way through a French cookbook, and they love cream and butter in the food, and then a garnish of cream and butter. And I actually said to the surgeon, it's your fault that I'm in here. And he went, I don't understand. Je ne comprends pas. So, but yeah, it was a scary moment, but it was a bit of a blessing, if I'm honest. Some people won't understand that, but it kind of really brought my whole life into perspective at this young age of 59. And it's driven me to take the next step.
Yeah. What? So it must have been really scary being abroad. How was that compared to like a UK kind of hospital, if you've ever been?
Yeah, so healthcare in France is different. It's a subscriptive service, so kind of private, and the treatment was just amazing, out of this world. I got some wonderful colour pictures of my heart, which was brilliant. I'm yet to get some from the NHS, but I don't think they buy colour printers anymore. No. So the service was amazing. And I had kind of 3 months there, so I could learn the language. I could pick up all the bits where I was defaulting on. But the team there, much like us here, it isn't a job, it's a vocation. And they do it because they love it. Yeah, I spoke to one of the nurses and she went, I hate this job sometimes. And I said, well, why do you keep doing it? And she went, people like you. Aww. People like the man in the room next to you. I couldn't honestly move away from it and be happy or comfortable.
Oh, that's really nice.
Yeah.
The hospital, when you came back, obviously you had some dealings with the UK healthcare again.
Yeah.
Would you say there's anything that the UK could learn, anything that France could learn? Could they learn from each other?
I think there's always areas that we could learn from, but systematically they're different. Yes, they have doctors, surgeons, nurses, but we're in a time where we're 50,000 nurses short in England and 12,000 doctors, and it's not going to get better overnight. Yeah. And that's not a fault of the staff that are working in there. They're doing an admirable job, and I'll salute them. We should have more clappy Thursdays. But I guess the difference is funding, and it's always funding. And so I've got nothing but good things to say about the NHS, even though I had a heart attack in May and I won't see a cardiologist till September on the phone, not a face-to-face visit. Yeah. But it's pointless me saying, the NHS are this, they should be doing this, they should be doing that. They're doing the best they can with what they've got. And so it's difficult when I hear people saying, oh, the NHS is rubbish, the NHS is this. And I just have to kind of gently, humbly encourage them to think a little bit deeper about that, because it's not the frontline staff that are causing the issues.
Yeah.
It's not, the budgets are going up and up and up every year because we're more densely populated as a country. You could take issue with that, but that's part of our values as a country,
Yeah, it's frustrating, isn't it? Because no one goes in to work and goes, you know what, I'm going to make a mistake today. You know what, I don't fancy seeing that person. I'm going to just push him back for another couple of months.
Yeah.
And it's just sad to see people that care and are working so hard get so much slack for something that they can't control. And, especially in like the patient safety area, and people look at that and it's blame, I'm gonna get you in trouble and all that kind of thing. And what we're about is about learning and improving and looking at the positives of patient safety instead. And that's the way it should be, they're human beings with feelings, and it, as much as if someone makes a mistake that can really affect the family and so on, that person that's made that mistake, that could change their life, and it's just awful, really. But going back to kind of your experience, has it changed your perspective on work?
In what sense?
Like, do you still feel like you want to do what you're doing, or do you think that you might do something different? How kind of, or just your approach to life, really?
Yeah, well, this is a long life mission for me. So whatever I do, it will involve healthcare, and I can't envisage retiring. Firstly, and that's not too many years away. And if I do, when I do, I'll certainly be doing something in and around healthcare, because it's so important, and it's kind of part of who I've been for the last 30 years. Yeah, so no, I don't think I'll stop working in healthcare.
Yeah.
Watch this space.
You might just coach a lot more. You never know.
Yeah.
Help other people in healthcare to achieve, guess what you have.
Yeah.
Yeah. No, it's really inspiring. I'm inspired by you.
Oh, good. Thank you. I'll send you the bill.
Okay. Yeah, that's fine. No, I would love, because I mentor I used to mentor like younger marketing professionals that are just starting out, trying to help them to, I guess, understand where they want to go, help them with their industry knowledge, with learning how to deal with senior management influence and things like that. And I love it. It's just it's so rewarding to help someone with their career, and it's nice. So obviously last couple of years we've had a pandemic.
Yeah.
Think something that's never happened before. Well, it will have done, but not that we've seen.
Yeah.
How is that? How do you think the NHS has changed in your time from when you first started going through this pandemic to now?
Wow. Okay. So
Big question.
That's a huge question, but let's try and answer it. So if we think first of all from a technology perspective, I watched the tech press. I watched the NHS tech press and health tech press, and let's just talk about one thing. So I worked with GPs for a number of years, and there was always this move, always this ambition to do video consultations, but life was too busy, practices were too busy, and so the normal model is to see your GP, you go and queue up at the surgery, and GPs might be running an hour late because of us patients coming in with 3 problems instead of 1, and all of this. And obviously there were lots of DNAs, so did not attend. And I think at the practice that I was at, the DNAs were such that it equaled 4 doctor's sessions a week. Okay, think about that every week. And a session is a morning or an evening session. So 4 of those sessions were wasted because patients didn't turn up. And so I think when COVID came in, it's easy to look at all the negative stuff around it, but somebody said, I can't remember who it was, but the NHS grew technically 15 years in a 2-year period. So there was the adoption of tech to help support the clinicians during that whole pandemic. And if I think of my own surgery, I'll use that as an example. You don't see the doctor anymore. You go through a triage process. So you book an appointment online, which is great. Everybody's doing that now. Then you'll get a reply, yeah, you can have an appointment with the doctor, or the doctor will call you on X time on X day. And so I think the advancement in that, and it doesn't work for everybody, okay, but for me, that's great. I don't always need to see a doctor. I mean, I do now more than I used to, but the ability to do that technically and have a conversation at a time that kind of suits me, and the doctor then perhaps gets away on time, doesn't have DNAs. The DNA rates have gone down by about 90%. So that's how COVID has changed, I guess, technically. But we were at an event in Excel a little while ago, and it's great to see everybody back together without masks, having conversations about healthcare. And I spoke to a surgeon, and I said to him, how has COVID changed your life? And he said, why do you ask that question? I said, because I'm genuinely interested. And he said to me, well, let me tell you. And we sat down and had a coffee. And he said, I've just come off of working 171 days without a day off.
Oh my God.
Because the need was so great.
Yeah.
And I paused for a moment and I said to him, I'm sorry, 171 days without a rest? And he said, yes, 171 days. And that was just, I asked him that the morning that in the press it said that frontline clinicians during COVID are suffering from PTSD. And this is something I've looked into quite a bit. And I said to him, so what do you think about that in the press today? And he said, I'll need to take a sabbatical to kind of go over and look at that, because I think I'm suffering from PTSD from doing that. But he would have gone back to work the next day. The nurse would have gone back to work the next day, wearing all of the apparatus that they had to in the hospitals. So I think there's been good and bad, but you know, let's celebrate how we've got through that. The time for kind of whinging and whining has passed, I think. It's saying thank you. I mean that.
Yeah. 171 days though, like you just think, especially a job like that where you have to be so just precise. How do you keep your brain working? Like it's just too much.
Yeah. That's where I think, look, we've all got this innate question in us. Have I got what it takes? We all go there at some point.
Yeah.
And the chap that I was speaking to proved it, time and time again. I guess as a clinician, what they will be asking, if such a thing happened, would I be able to stay the course? And it did happen, and they were able to do that.
Yeah. It's just sad though, isn't it? It's really sad.
Yeah.
Do you, on a kind of another note, do you think, and I'll explain why I'm asking you this, but do you think there are sometimes too many rules that clinicians have to follow? Like, no, I have to do it this way.
So if I think about my surgeon, I'm glad that he followed the rules and did it that way. I think when we make rules, we make them for very good reason, and it's based on the data that we've got at hand at that time. But I think we've just got to leave it to the clinicians to think, actually, if we need to change this, how do we do it, and what are the benefits of changing it? How's it going to benefit the patient? Because that's what everything's about at the end of the day. It's about that patient, that customer, that client, whatever we're calling them this week.
Yeah.
If rules need to change, let's move forward and change them. If they're okay as they are, let's leave it. Let's not push it.
Yeah, no, it's The reason I ask, so I went for a scan. So I have like little nodules on my thyroid, and I had to have a scan every, I think it was like 6 months, and then it moved to a year, and then I got signed off and said, come back if you ever notice a change. So I found a lump on my thyroid again, and so I rang up and I said, they said to come back. So I went for my scan, but then I found another one in the meantime. So I went for my scan and she said, where is it? And I said, well, I've got one, which is here, but I've actually found another one on the other side. And she went, well, I'm only allowed to scan one place, so which one do you want me to scan? And I was like, okay, what do I do about the other one then? She was like, well, you'll have to book another appointment. So for me, I'm thinking, you've not got enough appointments. There's a massive waiting list. Why not just do them one at a time? And sometimes I think maybe there are too many rules. Maybe are people scared to break the rules? Like, what do you think?
Yeah, I guess. Look, there's bureaucracy in every organisation, and but you will find those people that will kind of step outside the box a bit, take a bit of it. I think what you're talking about there is taking the initiative to do something, because I had a similar experience, and I said, well, I'm not going to book another appointment, and they said, well, let's do it now. So I think people taking the initiative, I think we need to encourage that a bit more, because it wasn't, well, who knows, and you were kind of, I would imagine, quite fearful about finding another one. So let's do them both at the same time. But I think it's a case by case basis. Was your life being threatened by doing 2 scans? Probably not. But then this referral has to tie up with what I've asked for. And if I don't get back what I've asked for, I'm now confused. But so I think taking the initiative to do things, we could do that a bit more.
Yeah, no, I agree. It's a tough one though, because people obviously feel like they have to follow rules and so on. But it's frustrating for you on the other side. And
they have to apply a cost to it. So if you do 2 scans, there's an additional cost.
Exactly.
And who do they bill that cost onto? So lots of questions there, I guess.
And have you seen the parking charges at hospitals?
I take a bike.
Oh, fair enough.
No, I walk actually.
It'd take me ages to walk, so I guess my final question for you really is, what would your advice be to anyone working on the front line now, but also wanting to go but might be a little bit scared to do it?
So I don't give advice, because my advice isn't as good as I think it is. But as an encouraging word, I'd probably say thanks for what you're doing right now. Thanks for deciding that this is the life that you want to lead. But always, I would encourage people to move if they want to move. If they want to do something different within that profession, go for it. Don't get stuck in a position and 5 years later say, I wish I'd done it then. Regret's a great driver. It is. There's no doubt about that. But if you want to move, do something else, do it. I'd fully support that. Fully support people moving in their careers and attaining that which they see as an aspiration, a goal, or even a dream.
I'm looking forward to all the coaching that you start to do, and
me too.
Some of the stories you're going to bring back and tell us how you've helped people.
Me too.
It'll be really
but
good.
It helps me as well. Because every time I'm with a client, I learn so much as well.
It's nice. You're the kind of person as well that likes to get to know people and understand people.
I think in the olden days they'd call it nosy.
You're very nosy, Terry.
Very nosy. Behind the curtain.
Great. So, final question. So this is a question we ask everyone.
Right.
So this is your what the health tech moment, and what this means is anything weird or a bit of a strange situation you might have found yourself in the healthcare world. If you can't think of anything weird, is anything just sort of a life-changing moment, anything like that?
Weird moment would be great.
Okay, go for it.
So the company that you and I used to work for.
Yeah.
I used to do a lot of the technical visits, so they were server-based practices, so all the data was held locally and so on. And when we were upgrading to the web version of the product, I went out just to check all the kit was suitable. And I said to the lady at reception, I need to have a look at your server. And she must have been in her late 70s, so really lovely, purple rinse. And she said, oh, come with me, love. I'm going up there to water the plant. I'll show you where it is. So we went into the IT room, and there was the server in the corner humming away with the plant on top of it. And she was pouring water into this busy Lizzie. And I said, actually, we may want to move that plant. And she went, well, I'll leave it there because it's nice and warm. So crisis averted, Yeah, so that was a strange moment. And one other, let me just, so similar situation. I went into the surgery, went to look for the server. It was in the doctor's room, and I pulled back the curtain, and a mouse ran out. And he said, oh, he lives in the back of the server. And I thought, how weird and wonderful is our NHS.
Couldn't he have, I don't know, are there wires that he could have chewed through?
Yeah, potentially. But, there was a plate missing from the back of the server, and that's where he lived.
Aww.
Mickey, his name was.
Aww. That's quite cute, actually.
yeah, in the doctor's office. Yeah, wonderful.
Imagine if a patient had gone in and seen a mouse.
Yeah.
That's cute.
Obviously, they shall remain nameless, and it was a very long time ago.
Yeah. Oh, no. Well, thank you so much for coming. I've
Thanks for having me.
To you, yeah. So next week we are joined by Jasmeet Ray. She works for RCH Care Home. She's going to be talking a little bit about the people plan for social care. So look forward to speaking to Jasmeet. Don't forget to rate and subscribe wherever you get your podcasts. And if you've got any questions for us, for Terry, for any of our guests, please email whatthehealthtech@radarhealthcare.com. Thanks, Terry.
Thank you very much.